A very good evening to one and all. Hope you all are doing good. Myself, Dr. Radhika Satishan, working as gynecologist at Virajana Ayurveda Foundation Hospital. So on behalf of Ayurveda Map, I invite you all for today's free webinar series, Anubhava. So it is organized by Ayurveda Map and it is sponsored by Dr. P. Ali Kutti's Kottakkal Ayurveda Pharmacy. So Dr. P. Ali Kutti's Kottakkal Ayurveda Pharmacy has been a part of its mother concern, Dr. P. Ali Kutti's Kottakkal Ayurveda and Modern Hospital. It has been there since 1965 and KAP manufactures around 400 classical products and 40 proprietary medicines in their GMP and ISO certified production unit. And they also develop ancient formulations into proprietary medicines after a series of tests and research studies conducted in their own R&D department. And they also have modernized medical laboratories. They also produce food and nutraceutical division. They have the food and nutraceutical division, which has a variety of dietary and nutritional supplements also. So I invite you all for today's session. So a brief account regarding our Ayurveda Map. It was started in 2016 by a group of young doctors and it was officially inaugurated by the most respected Dr. P.M. Varir sir in the year 2017. So at first we had in-hand practical sessions. So these are our in-hand practical sessions. And due to the COVID conditions, we had to shift our in-hand practical sessions into online sessions with the warm responses also that we received. So we kickstart with Varnyam, then we had Brajaka, Gala, and Prayana, it was a reorientation program, and Kriti, a product making, Dhyana, a therapeutic session, and Nayana, it was about the eye diseases, Vibha about cosmetic diseases, and Pushya, gynecological session, Medas regarding obesity and diabetes, Chipra, the art of cupping, Raksha, again a gynecological seminar, then Varnyam again, then Kshara, it was about the Sharakarma, and Vibha, that was recently got over. It was about the cosmetic preparations. And we also have a new venture that is Swadhyaya to support the students academically during this pandemic time. So one of the important things that I would love to tell you is that we have started, this is the first time that we are starting a postgraduate diploma in Ayurveda cosmetology. It is a one-year program and we are affiliated to State Council. So it is almost recognized in all parts of India and outside India also. So if you want to enroll for that, please contact Dr. Jasul. He'll give you the informations and this is a one-year program and we'll be having one class every week. So that is the schedule time. And as a part of this, we'll be having an inauguratory session. We'll be having a presentation and a scientific session by Dr. M.R. Vasudevan Nambudri sir. It will be on 13th February and we invite you all for that. It is a free session, so you can all take part on it. Okay. So I welcome you again for the today's Anubhava series. So today we'll be discussing about the case discussions in Jwara, and we have the most efficient sir, that is Dr. Mukesh E. He is the assistant professor, Department of Roga Nidana of Kottakkal Ayurveda College, and he is one of the most renowned person in Roga Nidana. And without much ado, I invite you, sir, for today's session. Over to you, sir.
Thank you. I hope the slides are visible.
Yes. Yes.
Okay. So, thank you once again for having me in this program. So, respected doctors and my colleagues. So, today we are going to discuss about some of the important experiences and concepts in Jwara Chikitsa. So first, when I was asked to do a session on Jwara Chikitsa, initially I thought I should not take up this subject because we as Ayurvedic doctors don't tend to get to treat much fevers. But I think recently, after this COVID pandemic came out, we also started attending so many fever patients. But when I sat back and I thought for the cases, because I have a habit of recording my cases, especially some of the interesting cases. So when I went through the records, I found out that right from 2007, when I finished my PGR, so around 15 years of my experience, I came across a lot of febrile patients. So this is what I am going to share with you today. There may be seniors in this group, so there may be some mistakes on my part that I have committed in my clinical practice. So all those things we can discuss at last. So what I'm going to do is that if I start sharing the patient story, then it will be just like we keep on narrating some patient stories. So rather than that, what I have made is that I tried to incorporate the basic concepts of Jwara Chikitsa. Right from the Lenka through the Sodhana and until Rasayana. So how myself, I have applied that in my patients and what results I have got. So that is the way in which I am going to present my data today. And at last, we will have a small discussion as well. So first, let us see some of the basics. What is fever and why it happens, and how we should approach a patient with fever, and what are the diagnostic, what you call as points that we have to uh, consider when we approach a patient with fever. So the term pyrexia, the technical term for fever, it indicates an elevation of body temperature above the normal circadian range. And this happens as a result of a raised set point in the thermoregulatory center, which is located in our brain, that is anterior, located in the anterior hypothalamus and preoptic area. So usually the circadian range, usually the lowest temperature is between 2 to 4 am and the highest is in the afternoon hours. So a 99 in the evening may not be considered as a fever, but a 99 in the morning should be considered as a fever. So that's the so whenever we consider the temperature, we have to always look at the time as well as the site where we have examined the temperature. So that is very important to decide whether the patient has a fever or not. And different schools have classified the fever into different categories, so that hypothermia is usually 95 and below, subnormal is 95 to 97 degree Fahrenheit, normal is somewhere between 98 to 99. So we have learned it is 98.6 degree Fahrenheit, but the range usually is between 98 and 99. And mild fever is somewhere between 99 and 100, then moderate between 100 and 103, and high fever 103 to 105. And the term hyperpyrexia, which indicates a fever which is more than 105 degree. So the substances that induce fever are called as pyrogens. And these pyrogens can be exogenous, like a bacteria or its toxins or its byproduct, or even in case of gram-negative bacteria, the lipopolysaccharides or LPS that is present in the what you call a cell membrane of that bacteria itself can act as a toxin, something called as an endotoxin. So all these things which are not part of our body, but when enter into our body, elicit an immunological response leading to pyrexia can be considered under the category of exogenous pyrogens. And endogenous pyrogens are cytokines and other polypeptides that are present in our body. So whenever there is an immunological reaction that is going on, when these factors are expressed, they initiate a cascade of events that leads to the raising of the thermoregulatory set point and the fever ensues. So basically pyrogens can be exogenous and endogenous. And there is another term known as cyrogens. Cyrogens means all those factors that prevent the raising of this thermoregulatory set point. Again, factors like interleukin 10, etc., acts in this way. So a balance between the cyrogens and pyrogens usually decides. So whenever the balance tilts towards the pyrogens, then the fever ensues. And when the balance tilts towards the cyrogens, then the fever subsides. So this is what happens when there is a febrile response in our body. So what are the causes of fever? So we discussed already what is pyrexia and what are pyrogens, and endogenous and exogenous pyrogens. So what are the causes of fever? So usually we all know infections, then neoplasm, vascular causes. For example, particular types of strokes can induce fever, febrile response. Traumatic causes, immunological causes, especially diseases like autoimmune or autoinflammatory diseases, they induce fever. Then endocrine causes like thyroid, adrenal, then metabolic causes hematological, physical agents, and as well as miscellaneous causes like factitious fever, where somebody mimics a fever. So, and even psychological causes of fever can also be there. So these are some of the important causes of fever. So typically in a immunological challenge, what happens? Two important pathways. There is a neural pathway as well as a humoral pathway. Both of these mechanisms gets initiated or stimulated, and through different what you call pathways, they try to influence the thermoregulatory set point. And when the set point is raised, then there is what you call as heat conservation. So peripheral vasoconstriction will ensue. So the patient will start somewhat cold. And following that, if the set point is raised to a very high point, then the body tries to generate heat as well. So the patient will start getting rigors. So chills and rigors will happen. And ultimately, the body will also take necessary action to prevent heat loss as well. So this heat gain plus reduced heat loss results in an increased body temperature. And these cyrogens like interleukin 10, etc., they act in a negative way because when they act, they prevent this what you call as raising of the thermoregulatory set point, and the fever will be coming down. And whenever there is an immunological response, there will be some acute phase responses that happens. So we know the term acute phase reactants, especially C-reactive protein and ESR are considered as acute phase reactants. There are other acute phase reactants as well, but basically C-reactive protein and ESR that we usually use in our practice. Apart from that, acute phase responses can happen, like the patient will feel somewhat sleepy, then the patient will develop anorexia, then there will be changes in the metabolism as well that is associated with this febrile response. So this is what happens in fever. You can look into this article that I have cited here for the details. Those who are interested in further reading, you can go to this article. So why fever? So now we understood how fever happens and what are pyrogens and all those things. The next question is why such a response happens in mammals. Not only in mammals, this febrile response happens in almost all what you call living organisms, a majority of the living organisms. So why this fever? So why this happens is because the elevation of body temperature increases the chance for survival, and the temperature itself appears to increase the phagocytic and bactericidal activity of the neutrophils. The cytotoxic effects of lymphocytes is stimulated, and the growth and virulence of several bacterial species are impaired due to the high temperature. There are other theories as well, but these are some of the important hypotheses, theories behind why the fever happens in our body. Then there are different patterns of fever that can happen based on how the temperature happens in the body. So if you take our textbook, even right from Charaka, they have told Vishama Jwara, where there is Vaishamya in the temperature. The same thing is observed by the modern science as well. So usually the fever, basically the fever can be classified into three. There is a continuous fever, a remittent fever, and an intermittent fever. So a continuous fever means the temperature remains above normal throughout the day, but the fluctuation is less than 1 degree. So the temperature never touches to the normal. It is always above the normal throughout the day, but the fluctuation in the different readings is less than 1 degree. And if the temperature is above normal throughout the day and it fluctuates more than 1 degree, then it's called as remittent fever. So when we teach, most of the students, they get confused between remittent and intermittent fever. So it is very easy to understand. So whenever there is a total break in the temperature, it's called as intermittent fever. But in case of continuous and remittent fever, there is no break. Usually the temperature is on the higher side throughout the day, and the fluctuation, if it is less than 1 degree, we call it continuous. And if it is more than 1 degree, it's called as remittent fever. Then there is intermittent fever, where the temperature is present only for some hours and it comes back to the normal. So this is intermittent fever. It is again further classified into quotidian, tertian, and quartan. So quotidian means daily one spike, tertian means every third day, and quartan means every fourth day. And then there are other terminologies like hectic fever or septic fever, where the temperature variation is very high. And then Pell-Epstein fever, where the patient will have fever for a period of around 3 to 10 days, followed by a gap, and again fever for next 3 to 10 days. So the question is whether these fever patterns have any diagnostic value in the present era, because previously in the pre-antibiotic era, the doctors during those times, they used to rely upon these patterns to identify what is the causative factor. But after this advent of all these antipyretics, especially paracetamol and the steroids and antibiotics, so in the current era, these patterns are of no important diagnostic values, because most of the time when the patient starts having fever, either on the first day or on the second day, the patient will be put on any of these medicines. So this pattern will be altered. So these patterns are of not that much diagnostic value as far as a currently practicing physician is concerned. So this is not my opinion. This is as per the article that I have shown you previously. So in present scenario, there are some fevers which can show you such patterns. For example, continuous fever can be found in case of lobar pneumonia, typhoid, urinary tract infections, or typhus fevers, etc. And quotidian fever usually in Plasmodium falciparum, tertian in case of vivax, quartan in case of malaria. So like that. But the problem is, as I told earlier, these patterns are not that much appreciable nowadays because of the use of all these medicines. So what are the effects of fever? So once there is a what you call stimuli, there is a pyrogen, and this pyrogen initiates an immunological what you call cascade of events, and the fever happens. And the next question is, what are the effects of fever? So the fever can have a systemic effect, a local effect, as well as effects in the cellular level. So systemic effects include, if at all there is a bacterial infection, etc., there can be endotoxemia. Then the main important thing that we have to consider in the present era, but the current evidence suggests, is the changes that this fever can impart on the gut microbiome or the gut microbiota. And the next one is the local effects like cytokine stimulations, inflammatory response, vascular stasis, and extravasation, edema can happen. And in the cellular level also, there can be mitochondrial damage because of the persistently high temperature. And there are a lot of metabolic reactions that come along with a febrile response. For example, the body will slowly start shifting from the glucose metabolism into the ketogenic mechanisms as well as lipolysis, etc. So there are changes in various levels whenever there is a febrile response. So that is regarding some of the basics of fever. So why we have to, we discussed all these things is because when we come into the Ayurvedic component, we are trying to answer so many doubts that have kept into our mind when we read our Samhitas. So Acharya have told Yavagu, he has told Lenkana. There are so many protocols that have been explained in our textbook which are purely observation based, and they might have observed for in several thousands of patients before writing it in Samhita. So most of the times when we start reading, when we in the final year, when we start studying the Chikilsa Sthana, Jwara Chikilsa, sometimes we may be wondering why Acharya have told all of these things. So in order to understand or decode all those things, this preamble is very important. That's why I went through some of the basics. Next is how to approach a patient with fever. So whenever a patient presents to your clinic with fever, what are the things that we have to take care of? So the three important things that you have to do is a detailed history taking. That is very, very important. Yeah, there should be a thoroughly executed clinical examination, and we have to always order relevant investigations. The term relevant is very relevant because we tend to write a lot of investigations, and the patient will go through all those things with spending too much amount of money. And sometimes all these things will not give you enough information in order to aid you in the diagnostic process. So whenever we order an investigation, it has to be very relevant. So in case of history, the onset, that is very, very important to be asked, and the pattern of fever is very important. So unless the patient has taken some modifying drugs, other than that, you can ask for the pattern of the fever and how was the onset. And always ask about the associated symptoms, because that will give you a clue in which system the pathology sends you in. The chronology of the symptom is again very, very important to identify the cause of the fever. Then to identify the cause, you can again ask several questions like history of travel, drug use, occupation, hobbies, addictions, a lot of things, family history, use of pets, area of residence, because there are fevers which are endemic to certain areas, allergies, etc. etc. So these I'm not going into detail because we all are experts in that regard. In case of clinical examination, a well-executed general examination is very, very important, because when a patient comes with the fever, the patient will give you so many clues throughout the body. So once you fail to execute a properly done general examination, then you may fail to identify the locus or the focus which has initiated the febrile mechanism. So a general examination is very important. Vitals again. Usually we can check the temperature orally, axillary, or rectally. The rectal temperature is more close to the core temperature, but usually that is not feasible. But in children, it is possible, and we can do that. So axillary temperature is highly notorious. So what you can do is you can make the patient to buy a thermometer. It costs hardly around 90 to 100 rupees, and you can check the oral temperature. Why I told you to ask the patient to buy the thermometer is because using a common thermometer is not ideal. So that is why you can ask the patient to buy a thermometer. And it's better to maintain a temperature chart as well. Examination of the pulse is again very important. So because there are so many conditions where there is a temperature pulse dissociation that can happen. Then a general survey of the skin is very important, because there are a lot of fevers that are associated with the skin eruptions and so on. Examination of the joints, cardiovascular system, respiratory, abdomen. And in case of nervous system, we can do that based on the presenting symptoms in the patient. If at all you suspect that there are some neurological symptoms that is complained by the patient, then you can go for a nervous system examination as well. And specifically, we have to look for the oral cavity. It is very, very important to examine the oral cavity, eyes, nails. Again, sometimes what happens, we may forget to examine the genitals, because I know a patient who developed a fever, a febrile response, and the focus of that febrile response was not identified until the 7th to 8th day, when the patient's perianal area was examined, where there was an abscess. So such things can happen. So whenever you find that there are no predominant associated symptoms, always don't forget to examine the genitals and perianal areas, and make sure that you palpate the lymph nodes. That is very, very important. So there are so many fevers where the temperature pulse dissociation can happen. So usually they say that for 1 degree rise of temperature, the pulse rate will go up around the rate of 10. But there are conditions where this will not happen. So especially in case of typhoid fever, brucellosis, leptospirosis, factitious fever where the patient is mimicking fever, acute rheumatic fever with a cardiac block, conduction anomalies, then also this dissociation can happen. Viral myocarditis. Again, we know that the present COVID-19 is or was causing features pertaining to myocarditis. So in such anomalies, there can be temperature pulse dissociation. In case of investigations, usually we don't investigate patients right away. So the general consensus is that whenever the fever is present beyond the 3rd day, you have to investigate it. So this is not what you call a general rule, but that's a consensus that whenever the fever is beyond 3 days, it is better to investigate. But whenever there is an endemic, a pandemic going on, or whenever there is an epidemic outbreak, then right away you can go for example, a few years back, there was a dengue outbreak here. Chikungunya outbreak was there some 12 years back. So in such scenarios, based upon the epidemiology of that present area where you are practicing, you can go for the investigation, irrespective of the days of or number of days of the fever. So usually generally we should go for a complete blood count with the differential, ESR, and C-reactive protein. And all the other investigations should be reserved based on the clinical suspicion of the clinician, again, which in turn is based upon the associated symptoms that are present in the patient. A CBC will give you a general clue. For example, whenever there is a rise in the total leukocyte count, and if the neutrophils are more, then you can suspect that it's most probably a bacterial infection. And if the total count is less, and whenever the differential shows that the lymphocytes are more, then it indicates that most probably this is a viral infection. And if the eosinophils are more, it may be a parasitic one. So like that, with the help of the differential itself, we may be able to get what you call an approximate picture of what the patient has. Again, ESR and CRP, they are acute, what you call acute phase reactants. So whenever there is an inflammatory response, these will rise. Then in suspected case of urinary tract infections, we can go for urinalysis. Chest X-ray can be done. But all these things are based upon the associated symptoms that are present in the patient. So don't simply order all these things. We should go with the what you call something called as a common sense approach. So as far as Ayurvedic doctor is concerned, our dilemma will be whether to keep the patient or to refer the patient. So these are usually my criteria when I refer the patient or when I keep the patient. So if you can keep the patient within first 3 to 4 days, because the picture may be in the evolving phase, or within 3 to 4 days the fever will resolve. So first 3 to 4 days, definitely we can keep the patient unless the patient doesn't have any severe what you call features like altered sensorium, neck stiffness, or electrolyte imbalance, etc. All mild febrile illnesses we can keep and treat. Influenza-like illness, especially the COVID-19, influenza-like illness without respiratory distress, we can keep. Uncomplicated viral fevers like COVID-19, dengue, chikungunya, hepatitis A, measles, chickenpox, all these things, uncomplicated ones, we can keep and we can treat, because Ayurveda always believes in assisted healing. So we just assist the body to heal. That's what we are doing. So we don't use antipyretics like paracetamol. So what we do is the body will be going through that natural healing process and we will assist that. So this assisted healing we can do in a very good manner, because once you put the patient on antibiotics, already the gut microbiota, etc., will be disturbed by the febrile mechanism. And again, you put the patient on antibiotic, all those things will be further affected. So all these fevers we can keep. But if the fever is persistent beyond 4th day and it's not responding to your medicines, and whenever there are warning signs, just like as I told, the neck stiffness or altered sensorium, etc., or whenever there is a respiratory distress, so all these things, and whenever there are some metabolic changes, so all these things we should refer, especially fevers in case of immunocompromised individuals. And diagnostic cases of typhoid, leptospirosis, etc., it is better to refer, because if you keep fevers like typhoid, sometimes they may land up in complications. So modern, they definitely have better management than us. So it is on the patient's interest, it's better to refer such fevers. So again, patients with the bleeding manifestation, up to some extent we can keep, but if you suspect internal bleeding, it's always better to refer the patient. So this is a general criteria that we can keep in mind, whether to keep the patient or to refer the patient. Next is Ayurvedic approach to fever. So how we should approach a patient with a fever. So usually what we do in our practice is whenever a patient comes with fever, usually I'm not blaming everyone, but usually what we do is we just ask few questions, whether you have a cold, whether you have throat pain, whether you have abdominal pain, vomiting, etc. We usually don't go for a thorough clinical examination. Especially in the COVID pandemic time, we usually keep the patient very far and we do that. That's okay with that. But previously, pre-COVID era also, usually Ayurvedic doctors, they don't examine patients properly. Maybe there are few of them, they do that perfectly, but most of them I have found that they don't do the patient examination in a thorough manner. So that has to be done. So we usually what we do, we get patient, we write Amrita Arishta, we write Mrityunjaya Rasa, or we write Amrudottara Kashaya, etc. So it's not like that. So we should not go in a what you call one-on-one diagnosis like. So I have seen doctors diagnosing typhoid as Andrika Jwara and they write medicines. It's not like that. We have to apply the spectrum approach, so that there is fever and what are the associated symptoms and in which spectrum we can put the patient. Whether we can put the patient in the Jwara spectrum, or based on the associated symptoms, we should put the patient under some other Vyadhis, because this Jwara can be a Rupa or a Lakshana of another Vyadhi as well. So that we will discuss later on. So the spectrum approach application is very important. And the second thing is that instead of a generic approach, like as I told, writing Amrita Arishta, etc., we should be able to customize the treatment to the given patient. So we always say, or we boast that Ayurveda is holistic. But what we usually do in practice is we just go with a pattern like prescriptions. So that is not the way. We have to customize the treatment to the given patient. That is the thing. So whenever we diagnose fever, the assessment, Ayurvedic assessment should be in such a way that we identify the therapeutic indicators in the patient, which helps us to customize the treatment in the given patient. And the approach always should be a dynamic one. Why I say dynamic is because the dosha avastha and the other avasthas like ama avastha, nirama avastha, etc., they change during the course of the illness. So you cannot prescribe, you take Amrudotra Kashaya for 2 weeks and come back after 2 weeks. That's not the way we treat Jwara. Maybe even within a span of 1 or 2 days, you may have to switch the medicines. So this is very important. So we should be always dynamic in our prescription so that the constant assessment of the patient and we look at the patient response and the change that happens in the patient's body, and the prescription should be reflective to that. That is very, very important. So our approach should be a very dynamic one. So let us look at the Sambhrati first before going to the treatment. So whenever we ask students to draw Koshta and Shaga, they may draw a stomach, they may draw some intestine, etc. And Shaga, for Shaga, they write, they draw the upper limbs and lower limbs. But this is another way of looking at the Koshta and Shaga. So we have this Koshta in the middle part where all the ingestion, digestion, absorption, etc. happens. And the rasa takes this nutrition into all the other dhavas. So you have the rasa, rakta, mamsa, meda, etc. So usually the Koshtagni acts in this way. So in a normal physiology, the Koshtagni happens or works in this way. So there is a ingested food, the Agni digests that. That is absorbed by the what you call rasa, and that is circulated. And even the what you call as per the Kshira Dadi Nyaya, etc., or Kale Kabodha Nyaya, etc., the transformation happens through this way as well. So this is the general physiology. But when what happens when there is ama formation? So this ama, you know that ama can cause Rodha Rodha. So whenever there is Rodha Rodha, the Agni cannot work in this direction. So Agni is obstructed. And we know the Vada which is stimulating the Agni, right? So this Agni has to go somewhere else. So the Agni goes out. That's the Sambhrati Acharya says. So there is a what you call a unique concept that happens in the body that is beautifully picturized by our Acharyas. So the Koshtagni goes out of the Koshta. So where it goes into the rasa, and this heat is supplied all over the body or circulated all over the body, so that there is Jwara. So actually what happens is there is a metabolic shift, so that there is a shift in the metabolic process from the center to the periphery. So usually what happens, the body has to generate heat in case of fever. So in order to generate heat, more catabolic activity happens because the breakdown releases more temperature. So there is a metabolic shift. So that rather than construction, more of a destruction happens in the body. So this is the concept that is what you call explained by Acharya in our textbooks. So the treatment also should be directed against to remove this obstruction so that Agni can come back to the normal posture and the metabolism is restored back to the normalcy. So this is what happens. Again, this picture we can use in case of Vishama Jwara as well. For example, Santada Jwara, rasa is the seat. So ama formation is directly entering into the rasa, and this is a constant process. So there is a persistent fever, Santada Jwara. But Sadadaga Jwara, the recta is the asraya. So when the dosha takes asraya in the recta, there is a time lapse between the formation of ama and when the ama can enter into the recta. So this is beautifully explained by Ashtanga Sangraha as well. Sukshma Sukshmadara Seshu Dura Dura Dareshu Dosha Rektadi Margeshu Shenair Alpas Chirenava. So this is why Tena Ayam Vichinna Sandabo Likshade Jwara it is told. So that the Vichinnatva of the Sandab or the break in the temperature happens due to that. So further, if the Jwara is seated in the May, the Sasti, etc., then the Tridiyega Chaturthaga Jwara, etc. happens. So this is our concept regarding how Jwara manifests. So just like we discussed about the pyrogens and thermoregulators at point in modern, this is the concept what we can explain based on our understanding. And then there is another concept of Nishpratyaniga and Sapratyaniga. So if you go through the references, you can see that there are so many factors that prevent the manifestation of fever in our body. So that include intrinsic factors like Prakriti, the Rogi Bala, Sara, Ojas, the status of Agni of the patient, Ahara Vihara of the patient, and extrinsic factors like Desha, Kala, etc. So there is an interplay between all these factors. So whenever there are factors that are opposing the manifestation of a fever, they are saprateniga. And whenever there is a saprateniga bala in the body or sub factors in the body, either the fever doesn't manifest or the fever can manifest only when all these mechanisms are favorable. And in all the other time, there will be a break in the temperature. But in case of Santata Jwara, all the factors are favorable for the manifestation of Jwara. So no one is opposing them. So that is Nishprateniga. So why I told this concept is because our job in management is to make the Nishprateniga into something that is Saprateniga. So whatever factors we can modulate through our treatment, we have to modulate that so that there is the fever is taken care. So this concept is very, very important. The factors that work against and factors that work for or favorable to the manifestation of fever. And variability in the degree of manifestation among individuals happens because of this concept. Even in COVID-19 that we have seen, there are so many individuals who get into severe illness, and there are so many individuals who doesn't have any symptom at all. So this why happens despite the immunological challenges because of the interplay of this factors that either work as antagonist or agonist to the manifestation of fever. Then the confusion that arises in our mind is whether we should take Jwara as a Lakshana or Jwara as a Vyadhi. So this one simple thing that I do in my practice is that if the fever is the predominant manifestation in the body, so that throughout the day there is temperature or there are more than 3 to 4 spikes of fever in a day, then we have to consider that as fever, Jwara as a main Vyadhi. But there are other conditions where, just like you take rheumatoid arthritis, or there are so many other conditions where Jwara can happen either during the onset of the illness or during any time of the course of the illness. So in such scenarios, what we can do, we can take Jwara as a Lakshana rather than a Vyadhi. But one thing that we have to keep in mind, the principles of Jwara management is relevant in both these cases. You take a patient with typhoid who presents with a fever as a predominant manifestation. They are also equally Jwara Chikitsa is applicable in that avastha. You take another patient with rheumatoid arthritis. Since last 5 years, the patient has rheumatoid arthritis. But since last 2 days, the patient developed a febrile response. At that time, also, the Jwara Chikitsa is very relevant. We cannot go and write Manjishtadi in that patient. You have to address the Jwara first because, as I told earlier in the Samprapti, the Agni has gone out of the Kosha. So whenever the patient comes with the Jwara, we have to think there is no Agni in the Kosha, it is going out. There is a metabolic shift that is happening. So first correct the metabolism, then you start treating the main Vyadhi. So whatever may be the thing, the importance has to be given to the Jwara Chikitsa. That is why even our teachers has taught us that if you study Jwara Chikitsa properly, you can treat any disease. So let us see what are the therapeutic determinants that we have to see when we write the prescription. I have included examples as well, so we can discuss all those things. So there are patient-related factors that we have to see, as well as disease-related factors that we have to see. So basically, we have to assess the prakriti. Again, that is very difficult when a patient comes to you with a fever. So what you can do is you can just go for even in a normal clinical scenario, in a patient who comes with knee pain, etc., the prakriti identification is different. So when patient comes with fever, especially with severe manifestations, the prakriti identification is very difficult. But you can ask some of the previous things and you can get an average idea about what the prakriti may be. The bala at that time of the at that time period, satmya of the individual is again very important. It's not like sarvarasa satmya and agarasa satmya. That is something else. Here the satmya means whether the patient, what type of food the patient prefers, what type of medicines the patient may be satmya to. So why? Because you may be needing to write kashaya, but the patient will tell you, no, I hate kashaya. If you show me kashaya, I will start vomiting. So such satmya assessment is also very important. That the cost of the individual is again very, very important. And even the Agni status also is very, very important. Disease-related factors like the dosha predominance at that given point of time. Why I told at that given point of time is because during the course of the illness, this dosha predominance can vary, even in the same individual, even in the same disease. This we have seen. So the dosha involved, the srotas, the ama, niramas, and all those things you know. And also one thing that you have to keep in mind is the extrinsic factors like desha and kala is very, very important when we treat. If you take Chikitsa Manjari, which is a Kerala textbook, the first thing that he says in the Jwara Chikitsa is kala. You have to look at the kala before starting the treatment. And this we have to keep in mind. Dosha avastha may vary throughout the course of the illness. So don't prescribe one medicine and forget it. Just like the Hero Honda commercial that was there before. Fill it, shut it, and forget it. So like that we prescribe and we forget it. It's not like that. We have to continuously assess the patient and make necessary changes in the prescription. So how to identify the dosha avastha? This is another important or confusing thing that we have, because there are a lot of references in our textbooks. So one simple thing that you can do is you look at the pattern of the temperature. So whether the pattern is irregular, so that when the temperature comes and it goes, which is highly irregular or unpredictable, and the patient has a pain predominant manifestation, so headache, body pain, bone pain, muscle pain, etc. So too much of ache. So that is found in case of the new Omicron variant. So previously, in case of COVID-19, the respiratory features were predominant in the initial days of the COVID-19. But now what we see now is that the patient gets fever, severe back pain, neck pain, headache, etc. So body ache is a predominant feature. Dry throat and mouth, tinnitus, shushka chardi. That means the patient will get a tendency to vomit, but the patient doesn't vomit that much vomitus. Irrelevant talk, so that there is the patient goes into delirium. So there is irrelevant talk. Mala apravartana, kashaya rasa in the mouth, desire for warmth, etc. If the patient has these features, consider the presence of vada. So why I say consider the presence is because this may not be the only presentation in the patient. So if these features are present, it indicates that vada dosha is involved. If the temperature is rises very suddenly and the patient has excessive thirst, usually the patient will have oral ulcerations, very reddish, strawberry-like tongue, then skin eruptions like petechiae or purpuras, caturrhea in the mouth, very red eyes, conjunctival injection, etc. So all these things, and especially a foul-smelling breath, all these things indicate pitta. Excessive aruji. So usually aruji will be there. Excessive aruji, so that the patient doesn't even want to drink water itself. So excessive aruji. Then alpa vega, so that there is slow rise in the temperature. And relatively less temperature, so that the degree which is less than 1 or 2, like that. And madhurasa in the mouth, excessive salivation, respiratory features like cough or running nose, then chardi, then article rashes, which are not that much reddish in color. So all this indicates, again, associated with the severe itching, all this indicates a kapha presence. So what you have to do here is you just take down the number of lakshanas and you see whichever is more. And for some lakshanas, we may have to give some weightage as well. For example, the patient will have all the pitta and kapha lakshanas, but the temperature pattern is highly unpredictable. In such a scenario, you have to give extra marks for vada, and you start treating vada first. Then you address the other doshas. So like that, just apply your common sense and you can identify the doshas. And next question that come across is that the Nija versus Agantu controversy. So there are a lot of individuals who say that all these infective fevers are Agantuja in nature and not Nija in nature. So how we can make a, what you call, consensus regarding this approach? So personally, my opinion is that this manifestation of even a infective fever has a Nija component or an endogenous component as well, because that is proven in COVID-19 as well, right? If your immune response are robust, then even the virus will fail to initiate a febrile response or an infection. But there are other factors, for example, the viral load that the patient gets. So all those things are very important. I agree that, but still, but the concept of Agandu can be taken because it will help you. That is why here Ajare says, Hetu Aushadha Visishtascha, so that you know that exposure to a patient with COVID-19 will give you COVID-19. So if you agree that it comes from outside, then at least you can avoid, you can do Nidana Parivarjana. So there are some scenarios where we can consider it as Agandu, because anyway that we have to treat based on the dosha itself. So to reach in a general consensus, we can say that there are both components, but considering these as Agandu has some benefit in the practice. So unless you don't have any benefit in practice, there is no use of this lip exercise. So this concept has some benefit, then you can take it as Agandu. That's it. But whatever you call it, whenever you want to treat it, there are two things. One is Nidana Parivarjana, and the second thing is you have to treat based on the dosha that is predominant in the given patient. So what are the fever management strategies? So what kind of strategies we can apply in managing fever? So these can be classified into two. That is management of acute febrile states and management of chronic fevers. Why I told chronic fevers is there are so many chronic conditions where fever can occur as a co-manifestation. Acute febrile states, of course, we know that most of the infective fevers are acute febrile states. So in acute febrile states, we can go for Lankana, Vamana Virajana, Pajana Dibana, Shamana, and Balavardhana. So there is no need of a planned Shodhana in such patients. But in case of chronic fevers, you have to go for Dibana. You have to go for a planned Shodhana, then Rasayana as well. Then the next question is when to decide whether we have to go with Shodhana or Shamana procedures. So a simple equation that you can make is that in case of acute fevers, especially infective in origin, and if the even in chronic fevers, if the Rogi Bala is Avara, then always stick on to Shamana, don't try Shodhana, because the patient doesn't have enough Bala for tolerating Shodhana. In case of chronic fevers, chronic febrile pathologies, and if the patient's Roga Bala is good, then we can go for Shodhana. And even in some cases of post-febrile manifestations, we can go for Shodhana. So Acharya says Taruna Jwara is up to 7 days, Madhyama is up to 7 to 12 days, Purana is after 12 days. Again, there are a lot of difference of opinion, different Samvedas. So let us forget that this is a general consensus. Up to 7 days, Taruna Jwara, then 7 to 12 days, Madhyama Jwara, and after 12 days, it is Purana Jwara. So how to plan a treatment strategy? So this is what I usually do in my practice. So first 3 days of fever. If the patient is Balavan, then we can go for a controlled Lankana. Aushadha Siddhapeya can be given. 1 or 2 medicines, especially aimed at Pajana, can be given, because only keeping the patient on Lankana, most of the times, if the patient is not loyal to you, if the patient is your loyal customer and the patient fully believes on you, because you are the family physician and the patient comes to you for every ailment, then if you put the patient only on Lankana without any medicines, that is practically feasible. Otherwise, what happens, there is an ethical issue as well. A patient comes to you with fever and you ask the patient, okay, you don't take anything, you just go lie down, drink hot water, come to me after 3 days. So then there is an ethical issue, as well as the patient will go to another doctor. So in such cases, you can give very minimum medicines. So this is for the first 3 days of treatment, especially in Balavan. But if the patient is Abalavan, or the fever is very severe and the patient is very weak, then what you can do is you modulate the diet. So Aushadha Siddhapeya, then you give Pajana and Shamana medicines. Next, 4th to 10th day of fever, you can try Pajana and Shamana. Again, Aushadha Siddhaya, if practically feasible, you can give. Why I am trying practically feasible? Because most of the patients, they will not adhere to that. You will advise that, the patient will not do usually. Then after 10 days, you can plan according to what is told in the Samveda, Shamana, Shodhana, Rasayana, whatever, as per the indication the patient you can do. So first, let us see Lankana. So I have told in the initial part itself that I have arranged this presentation in such a way how the treatment has been enumerated in the textbook, so that it will be easy to understand. So when to administer Lankana, the question is practically how we can apply. So anyway, we have explained the Lakshana. So if the patient has Kapha Pitta predominant manifestations, especially fevers of gastric origin, like acute gastritis, gastroenteritis, inflammatory bowel disorders, in such cases, when the patient comes to with fever, you can try fasting mode of Lankana, because Lankana, we know there are several modes. But in Charaka, at the context of Lankana, Chakrapani clearly states Lankana Shabdena Anashanam Vivakshidam. So in that context, Anashana Rubi Lankana is implied by Acharya in that context. So in case of gastric origin fevers, especially, we can go for fasting mode. Then what I have found is that in patients with fevers of autoimmune origin, like rheumatoid arthritis, ankylosing spondylitis, etc., Lankana is very, very effective. Even without any medicines, we can go for Lankana, a planned Lankana, and we get very good results. When not to give, especially patients with Vada Pradhana or Vada Pitta Pradhana Lakshanas, don't go for Lankana initially. You can try for 1 or 2 Annakalas, but it is better to avoid. So usually what we have found is, in case of viral fevers, most of the viral fevers, I am not comparing, I am against one-on-one comparison basically. But usually what we have seen in viral fevers, usually Vata component is always there in most of the viral fevers. I'm not telling about the rhinovirus, common rhinovirus infections, etc. But in most other viral fevers, usually there is a Vata component in the patient. And so that is why in such scenarios, it's better to avoid Lenkana. And Avara Rogi Bala, we know that. And Varsha and Grishma Ritu also, it's better not to try Lenkana. So these are some of the criteria that we can apply practically. And regarding the days, number of days where you have to give Lenkana, there are so many opinions. 1 day, in Pitaja 2 days, in Kafaja 4 days, like that. There are different opinions. But we can modulate according to our specific clinical scenario. So this is a case where a 22-year-old male patient who came with a low-grade fever, and the patient had indigestion also. And the patient had an episode of vomiting as well as 3 episodes of loose stools. So here what we have seen is here the main disease will be Ajirna, and the Jwara is a Lakshana. And the patient had Pitta Kapha Pradhana Lakshanas. So what we did is we asked the patient not to take anything for 1 day. And if you're thirsty, just drink Shadanga. Then on the second day, when the patient developed some appetite, we gave Pajanamrita Pada and very light diet. So this is a common clinical scenario. I'm not boasting that I have treated this patient. Even you don't give any medicines, this patient will be okay within 3 to 4 days. But why I highlighted this case is because just to understand that concept, where all we can apply the concept of Lenkana. Then there are modified Lenkana and Pajana protocols that we can do, where we can go for limited meal plans. And in patients who cannot avoid food intake, you can go for medicated diets. So what we can do, so this is another case of influenza. So this is in a pre-COVID era. This patient was, when I was a medical officer, way back in 2009 or something like that, I treated this patient. So this patient had fever, chills, headache, rhinorrhea, occasional cough with a sputum. There were no other associated features apart from these things. So the temperature was in the range of 101. The diagnosis was Kapha Vata Pradhana Jwara, and the patient was a very loyal patient, so that he used to come to the dispensary regularly for some other medicines, some other ailments. So he was agreeing to our treatment. So we told you don't take any food in the 2 annakalas, that is morning and afternoon, and evening you take light diet like kanji. So like this for 2 days was given for the patient. The patient had severe rhinorrhea, etc. So we asked him to do steam inhalation and all those things. And on the 3rd day, we started Tribhuna Kirtirasa, Vivashadi Varaka, and a paste of Rasnadi Churna and Jambira Varasa in the head. And on the 6th day, we started Dashamula Vadatrayam Vada, Dashamula Rasana, etc. So the patient responded very nicely. The patient didn't need any antibiotics. But usually in such patients, modern doctors, what they do, from the 3rd day onwards, they will put the patient on antibiotics, considering a secondary bacterial infection. Usually, such viral infections will be followed by a secondary bacterial infection. So the patient will tell on the 6th day, the sputum is very yellow in color, and there will be chest pain associated with the cough. So this patient, without any, again, I'm not claiming that I have treated this patient. It's a influenza. It may go on its own. So this is something like an assisted healing. We are assisting the body to heal. That's what. Another case was a patient aged 36. So this is a very interesting case. Here, the patient had a diagnosed case of ankylosing spondylitis, and the patient had persistent fever in the initial days. So especially the fever was there in the morning hours, and the patient had a sacroiliac tenderness and typical AS features. And the Amavada was diagnosed, and Jwara was considered as a Lakshana in this case. So what we did is we asked the patient to skip the breakfast. We gave Panchagola Yavagu in the afternoon, and Mudga Yusha along with the Rektashali was given in the evening. So what happened is there was no other medicines given except this Panchagola Yavagu, and within a period of 5 days, the fever subsided and pain also subsided. We also did a acute phase reactant profile of this patient after the 10th day, I remember, and the patient's CRP, etc., came very low. His CRP was in the range of some 30 something, and it came to 12 or something like that within the 10th day of the treatment. So this is something like a modified Lenkana that you can do. You can ask the patient to skip some meals and give a medicated diet as well. So what are the implications of Lenkana in infectious fevers? So that is what I told already. So in case of mild fevers, And especially fevers with the GIT symptoms, we can go for Hanasana Ruby Lenkana. In patients with a rheumatic fever, also we have tried Lenkana and it is very, very effective. Where not to do if the patient is dehydrated, for example, diarrhea, severe vomiting, patient is dehydrated, then persistently high temperature in the patient, so that the patient needs some food, otherwise the patient will collapse. So in such patients, don't go for any Lenkana. And even in severe viral infections, especially with the neurological manifestations, don't go for this. And even in case of immunocompromised patients, it's better to avoid Lenkana. In case of endogenous fevers, what we can do is that this is very effective. Especially the number of days is very important. Doing this for 1, 2 day, 3 day, etc. is not at all beneficial. You have to go and do it for a period of 7 to 10 days. So there, what you can do, you can go for the modified plan where you avoid any 2 meals and you give 1 meal in a day. And again, in weak patients, especially advanced RA cases, etc., they may come with a fever. So in such patients, again, children, advanced age, etc., it is better to avoid. And the patient, if the patient has severe recta features also, it is better to avoid. So fasting has been studied extensively by the modern medicine as a therapeutic tool as well. So what happens during fasting is it has several what you call positive effects on the body. So it reduces the oxidative damage and inflammation, and it improves the cellular protection and stress resistance. And even there are theories that says that it promotes the concept of autophagy. So you can go through this article if you're interested. Again, there are so many interesting observations. Earlier, I told that in viral fevers, usually the patient will have some Vadaja features, so it is better to avoid Lenkana. And while making this presentation, I read this article. So it's an interesting thing. See here, he says in this article, they say that doing or cutting the food in bacterial infection is beneficial, but cutting the food in viral infection is not beneficial, rather it is detrimental. So why they say that is because glucose utilization promotes tissue damage in case of bacterial endotoxemia. So it is better to cut glucose, so you don't give food. But it is protective. So inhibiting of glucose utilization is protective in endotoxemia, but it is lethal in case of viral inflammation. Maybe that is why Ajay told you don't give for in Vadaja Jwaras, you don't go for Lenkana. Only in Pitta, Kafaja, etc. Jwaras, you go for Lenkana. Again, I will ask you to excuse me. I am not comparing Vadaja Jwara with viral fever. That's not the way. Whenever there is a viral fever, the patient can have Kapha predominant Lakshana in 1 or 2 days, Pitta predominant Lakshana in other days. That is there. So always Avastha Vishesha is important, but still there are some interesting findings that we can work upon as Ayurvedic doctors. Again, even in COVID-19, they have proposed that before getting the infection, a plan for fasting can improve the immunological response to the disease. So there are a lot of studies that highlights the importance of Lenkana. Next is Vamana. So Vamana is usually in 2 ways it can be done. Either it can be done as a Sadhyo Vamana, or it can be done as a planned Vamana with a Snehavana and all. So we know that in case of a Jwara acute febrile response, we cannot go for a planned Vamana. So usually in Kapha and Pitta predominant, especially GI predominant symptoms, we can induce Vamana in the patient. And food fever that happened immediately after food intake. Again, if you go through references, you can go and see fast food induced fevers. There are a lot of literature available. You can go and refer. Sadhyo Bhuktasya Sanjade Jware, it's specifically told you can go for Vamana. Again, avoid in aged individuals as well as kids. So he says about Kapha Pradhana, Utklishtan, Doshan, etc. I'm not going to read this over here. You all know that. So this is again another case where we have induced Vamana, a low-grade fever following a dinner party. So these are common in our practice. So we either ask them to vomit by trickling their throat, or we ask them to drink Lavanodaka and we ask them to vomit. So here also Vamana was given, and later on Deepana with Agni Dundivadi was given. So usually such small fevers will be tackled easily. Even without treatment, you can do that. But once the patient comes to you, you can apply all these principles. Next, after Lenkana and Vamana, Ajay has specified about diet, isn't it? So there are a lot of studies going on in the current era regarding the gut microbiota and the importance of diet, not only in febrile response, but in all the other diseases. So this is very important as far as fever management is concerned. Even in the current COVID pandemic, we have seen that individuals who suddenly revert back to the normal diet, they tend to get long-term, I cannot say complications, but long-term illnesses like impaired digestion, weakness, etc., etc. But in those individuals who are adhering to our advice and who are ready to follow our diet plans, they tend to recover more, what you call, early than the other individuals. So simple things that are household items, you can ask the patient to prepare, because dhanya and nagara will be present in almost all Indian households. So you can just ask them to just boil these two things and drink, or boil these two things and prepare kanji in that, or ganji or yavaku in that. Saindava, if at all available, you can ask the patient to add. In individuals who have pitta predominant features, you ask them to add kshira to that. So just to prepare a kshira kashaya with the shundi and dhanika. These are all very simple, and every home they can prepare. Or if they have buttermilk in their house, you can just ask them to prepare buttermilk with some turmeric and jeeraga in that. So just cook that buttermilk. In Kerala, we have this preparation known as mukkudi. If you take all the Ayurvedic textbooks that have been written in Kerala, extensively they have dealt about the concept of mukkudi and where this mukkudi can be given. All those things are takra based preparations. Then panjakola, deshamula, legu panjamula, musta, all these things can be used again based on the dosha predominance. So if the patient has a kapha predominant features, kapha prakriti, etc., use panjakola. Vada predominant, you use deshamula. Pitta predominant, you use legu panjamula, or even musta can be used. So such easily available things you can ask the patient. At least if they are not able to prepare yavagu, ask them to prepare what you call just water and drink it. That itself is enough. Then while going through the Jwaradhikar, it is always important to look through the concept of the different yavagus explained. And if you look closely into that, you will come to know that Acharyas in those time periods were also knowing about the different system pathologies. For example, Jwara with Mutra Krichara, they have one type of yavagu. Jwara with Parsha Shula, they have another type of yavagu. Jwara with Shwasakasa, they have another type of yavagu. So they were knowing that different systems, when affected, they need to be addressed in a different way with a different target specific medicines. So that concept is very, very important. If anybody is interested, please go and work on that concept. So next is Shamana Chikitsa. So the initial two things, most of the times we may not be able to do. So whatever I have told you, my experience, these are very rare, because in most of the patients, we may not be able to advise Lankana, we may not be able to induce Vamana as well. So the most important thing that we usually do in our practice is Shamana Chikitsa. So my humble advice is that try to use minimum medicines in the initial stages. I have seen several prescriptions where the patient can, lie down on that prescription, that much long prescriptions for Jwara. So that is not at all needed. Very minimum prescription in the initial days, that is very, very important. Try to avoid Kashaya Kalpanas, especially Swarasan Kalka in the initial stages. And before prescribing, please identify the Roga Rogi Avastha. Just it might have printed in our brain, Jwara is equal to Amrita Rishta Mrityunjaya Rasa. It is not the way. You identify the Doshavasta at the given point of time. You identify which dosha is there along with the Agni. What is the Rogi Bala? What are the Anubandha Lakshanas? Because Jwara with respiratory predominant symptoms, you may have to give Bharangyadi Kashaya. Jwara with some other symptoms, bleeding manifestations, you may have to give Drakshadi Kashaya. So always look at the Anubandha Lakshana before prescribing the medicines. And also initially select between Pajana and Shamana medicines. So there is a difference. So initially the medicine should be Pajana in nature, then go for Shamana medicines. And again in Pajana, I have seen the doctors, they don't differentiate between Kadu Pajana and Tikta Pajana. Amrudottara Kashaya is Kadu Pajana. You take Pajanamrita Kashaya, that is Tikta Pajana. And what is the difference? You get a patient with the cellulitis, all the Pittaja features, and the patient has severe fever as well. And you give Amrudottara Kashaya, the fever may come down, but you will be doing harm to the cellulitis. I'm not saying Amrudottara because Amrudottara is possible in almost all Jwaras. It is Tridosha actually. But what I am saying is, if you give Pajanamritam rather than Amrutatra, it will be more beneficial. That's what I want to highlight. So it's not that you cannot give Mrityunjaya Rasa, you cannot give Vetumaran Gulika. It's not like that. But there are something better that can be given compared to your generic prescriptions. So that is why always differentiate. If the patient has Pitta predominant features, go for Tikta Bhajana. If the patient has Vada or Kapha Vada predominant features, go for Kadu Bhajana. Especially Kapha important features, Kadu Bhajana. And later stages, you can go for Samana Aushadhis. So these are the indications of Lenka. You can go through the text later. Again, Acharya says Pajanam, Samani, Amba, Kashayam, etc. Again, there is another interesting thing that we have to look into. So whenever we start prescribing Kashayas, try to make medicines with minimum number of dravyas. So there is an interesting reference in Ashtanga Hridaya, Arunadatta commentary. So here you see Bahudravyo Ghanakvadaha Swacham Alpaushadam Jalam. So usually in Kerala textbooks, if you see, even in Amrutatra Kashaya, it is told Satu Siddham Udagam. So there it's not told as Kashaya, it is told as Udagam. Why? Because there are 2 or 3 concepts that we have to keep in mind. The less the number of medicines that are present in a yoga, the more easily it gets digested. See, this is a generic rule. There will be exceptions. What I am saying is a general rule. So reduce that is why Amrutatra has 3 medicines. Musta, Parpadagu, Jore, there are 2 medicines. So the less number of medicines, the more easily the patient can digest it. Second thing, rather than number of medicine, the quantity of the medicines are also very important. The less quantity of medicine. So you don't add too much amount, then you boil it and you concentrate into 1/16. No, that's not the way in Jwara. You just make it half or 1/4 and you can give to the patient. Don't go for the typical Kashaya Kalpana. So Bahudravyo Ghanak Kvadaha. So that if you add Bahudravya, the Kvada become Ghana, so that the patient will feel very difficult to digest. Swacham Alpaushadam Jalam. So Swalpa Aushada should be prescribed. That is very, very important. So less number of dravyas, less quantity of dravya, and less degree of reduction. You don't reduce into 1/16 and all. That's not the way. Whenever if you want to give Kashaya in the Jwara. Then another thing that we have to keep in mind is regarding the use of Virya Pradhana Aushadas. So we use a lot of Virya and Prabhava predominant medicines in the initial stages of the fever to control the fever. So use that cautiously. That's what my message is. And don't mix different Virya Pradhana medicines. I have seen a prescription where there is Drakshadi written along with Vetumaran Gulika or Mrityunjaya Rasa. See, Mrityunjaya Rasa is Ushna and it may increase Pitta and it is Vata Kafara. Drakshadi is Vada Pittahara. So you mix both of these things, then it indicates that the physician doesn't have a proper dosha chinta in his mind. But you may claim that, see, I have prescribed that and I have got very good results. Then what is the fuss? There is no fuss about that. There is nothing bad. But the question is whether it is scientific or not, or the question is whether something better could have been given to the patient. That's the question. So again, prescribe based on the dosha predominance. That is very important. And a lot of examples can be given. You take all these yoga, Surya Prabha, Vettumar, Mrityunjaya Rasa, Ananda Bhairava Rasa, Tribhuna Kirti Rasa. So even I made an interesting comparison. You look at all these yogas, you can see in every medicine there is Vatsanava. So there are a lot of studies on aconite where how it induces diaphoresis, how it takes care of the fever, etc. One thing that you have to keep in mind is that don't give these medicines in a prolonged way. I have seen physicians writing Vetumaran Gulika in a rheumatoid arthritis patient for months together. That's not the way. These should be used very cautiously. Even if you have prepared it, properly also, it is better to use it cautiously. You look at this. This is a very interesting thing. There are a lot of things going on in this. It's very interesting to study all these yogas. You see, Inguleshwara Rasa, it is told typically in Vada predominant fevers. But if you look at the reference of Ananda Bhairava Rasa, he says Adhisara, etc. So GIT predominant pathologies. You take Surya Prabha, etc. Kasa, Shwasa, Jwara, etc. is told. So respiratory predominant fevers. So like that, we can look into this. But you see the commonality of these ingredients. So whenever you use that, you use it cautiously. We write a lot of Lakshmi Vilas Rasa, especially in COVID-19. We write a lot of Lakshmi Vilas Rasa. It has Dattur and Vijay in that. And you look at the Anupanas of Lakshmi Vilas Rasa, and you will find that it is not something that should be given in the initial stages. it should be given somewhat later because it has some rasayana property. And if you look at the Anupana, Dadi, Mastu, etc., it is better to be given in the later stage of the fever. Then there are some other yogas like Chukundipalyadi, etc., which may sound very, what you call, Kashta Ushadi, but it has Pashana and Tutta in that. So whenever you use such medicines, you have to use it cautiously. And there should be a dosha chinta behind that. But if you get a patient with a Sannibadha Jwara and if you want to bring down the temperature, at least for 1 or 2 kalas, you can give these medicines, but you should use it cautiously. So COVID-19 cases, because COVID is very high even now. So what you have to do is that, what we are doing is that you identify the dosha predominance in the patient, because usually it presents as a Vada Pitta Pradhana Sannibadha or Vada Kapha Pradhana Sannibadha. So Vada is obviously there in every patient. Either the patient will come with a Kapha Pradhana along with Vada or Pitta Pradhana. So accordingly, you select the medicines. Vada Pitta, you go for Pajanamrta, etc. Gopi Chandanadi, Sudarsanam Guliga, etc. Vada Kapha, you can go for Patya Kustumburadi or Bharangyadi Kashaya, like that. So based on the dosha, you identify the medicines. So this is a case of post-COVID dyspnea. Just I wanted to give you an idea about how we prescribe. So the patient developed exertional dyspnea, dry cough, etc. following the episode of fever. And the inflammatory markers were within the normal limits. And we identified the doshavasta as Vada Pitta predominant doshavasta. So we gave Dusparsha Vashadi Kashaya and Haridra Ganda, and followed by Panjamula Kshira, Karpuradi Churna, and Kombanjati Gulika. So here we solely based upon the dosha predominance in the individual. So there may be generic prescriptions like COVID-19 is equal to Samshamani Vadi, etc., etc. But my approach is slightly different. You identify the doshavasta at the given point of time, and then you prescribe. So this is another case of viral pneumonia. This is in the pre-COVID era. So the patient was diagnosed a case of viral pneumonia as a subclinical one in a modern clinic, and the patient was put on antibiotics and antipyretics. And our assessment was the patient was having Kapha Vada Pradhana Sannibadha Jwara and Vada Pradhana Prakriti and Madhyama Bala. So initially, the first week we put the patient, already 3 to 4 days elapsed when the patient came to us. So we in the first week we gave Patya Kustumburadi Kashaya, Surya Prabha, and Karpuradi Churna, followed by Bharangyadi Kashaya, Lakshmi Vilasarasa and Brigdarajasva. Then followed by, in the 4th week, once all the other fevers, all the other features subsided and Agni became okay, we put the patient on some Balavardhana drugs like Amrutaprasad and Makaratujavadi. So this is how you can prescribe in different phases of fever. This is another case, dengue. This patient we treated during the dengue outbreak some years back, which happened in South India. So the patient had an episode of diarrhea and severe body pain. So in those days, some patients had diarrhea before the febrile response in dengue, and NS1 antigen was positive in that patient. So we diagnosed it as Vada Pitta Pradhana Sannibadha Jwara and Pitta Pradhana Prakriti. So first day what we did is, the patient again was a regular patient in our hospital. So that is why the patient came to us. Otherwise, the patient will directly go to modern hospitals. So we did Lenkana for 2 Annakala, followed by Yavaku. And next 4 days, first day only we gave Lenkana because there was a Vada component. And next 4 days we gave Pajanamrita because the patient had a Vada Pitta Pradhana Lakshanas. So we didn't go for Amrudottara, Desamula Kadatra, etc. We gave for Pajanamrita and Sudarsana Vadi. And Draksha, again, Sudarsana is somewhat controversial because Sudarsana Churna, if you see, it is explained somewhat later part of the Jwara Chikitsa. And that yoga is somewhat complex. The patient needs some Agni to digest that. So if you give it in a Churna Kalpana, you make sure that there is some Agni in the patient. Because it is a somewhat, what you call, a medicine that has to be given in the middle to late stages of the fever. But Sudarsana Vadi is very small. The dose quantity is very less. So that is why we give initially. And second week, fearing the bleeding, etc., that may happen, we went into Vada Pittahara Drakshadi Kashaya and Arogyavardhini. Then on the 12th day, we gave a mild Koshta Virajana with Avibhatti Churna. And following that, when the patient developed Agni, we put the patient on Kalyana Grida for a period of 1 week and we stopped the treatment. So this is how Balavardhana you do in a patient in a sequential way. This is another case. UTI, I think almost every one of us will treat UTI. Usually what happens is, in Kerala, what we have seen is, when the patient has acute fever, we write Brihatyadi Kashaya. So usually what happens, when the fever is there, the Agni will not be proper. And you give Brihatyadi Kashaya, sometimes this Brihatyadi Kashaya itself will cause indigestion in the patient. I have seen a acute UTI patient along with fever, given Brihatyadi Kashaya, patient starts vomiting. So what we have to do is, you first manage the Agni, you bring back the Agni, then you give medicine specifically for Mutra Krishra. So here what we did is, the patient had Vada Pitta Pradhana Jwara with Mutra Krishra. So we again gave Pajana Amrita and Chandragala Rasa, which is told in Pitta Jwara, and followed by in the second week with Brihatyadi Vada, Kamadada Rasa and Avipatti Churna for a mild unleavened. See, you look at Avipatti Churna, you go through several textbooks. Avipatti Churna is told in different contexts in different textbooks, especially if you take Kerala Czech textbooks. In Ashtanga Sangraha, if you see, and other texts you see, it is told in the context of Jwara. But in some other diseases, it is told in the context of Gulma as well. So this is a very important yoga. For example, my teacher, Sharma sir in Udupi, he used to use Ayurveda Churna extensively. We don't know whether I have imbibed that from him, but even in my prescription, I use Ayurveda Churna extensively. But make sure that some Agni should be there for Ayurveda to act. So Ayurveda Churna was given in this patient. And in the 5th week, the patient was put under Shadavari Guda and Chandra Prabhavadi, and the patient became okay. So this one thing I want to caution is that a patient with UTI, don't directly write Mutra Krichahara medicines before correcting the Agni in the Koshta. You first give some Jwarahara and Agni Devana measures, then you go for Mutra Krichahara medicines. So that is regarding the acute management, that is the Lenkana, the Vamana, and the Shamana Chikitsa. The next question is Sodhana, because we have been taught that once you study Jwara Chikitsa, you can treat every disease. So what is the relevance of all these Sodhana told in our textbook, in our practice? I think it's already 8:50. I will try to finish within 15 minutes, if that is okay. Coordinators, is that okay?
Yes, sir. Yes, sir. Yes.
Okay. So what is the relevance of Sodhana Chikitsa? That is the next question. So Ajira says, Kriyabhirabi Prasavam na prayadiyada Jwara. So I have already given you so many measures to treat Jwara. And if the patient doesn't respond to any of these features, then only you think about Sodhana procedures. So we think that only in modern medicine they have all these treatment algorithms and criteria. That is not the thing. If you read our Samhitas with proper mind, application of our mind, we have criteria written all over the Samhitas. And these are elaborate algorithms. So this is one important algorithm. He says, all this treatment is enough for Jwara. And still, if the patient doesn't respond, then you think about Sodhana Chikitsa. So here the Virajana term indicates Virajana iridi Bahuvajanena Vamana Virajana api Grihyante, isn't it? So again, Acharya says, Duribhyo Bahudoshebhya, if there is a Bahudoshavasta and the fever continues beyond the stage of what you call Madhyama Jwara, Taruna Madhyama Jwara, then you think about Sodhana. So first is Vamana. Already we have discussed where we can go for a Sadhyo Vamana. So here the Vamana is Yadhakrama Vamana. That means I don't know whether this Yadhakrama Vamana term is ideal or apt. I usually use that term, but I don't claim that that is a final word. But the proper Vamana, where we give Snehapana, etc., it is usually indicated in Kapha Pradhana Jwara. So that is why the question arises, what is the difference between the Sadhyo Vamana and Yadhakrama Vamana that is told. So Yadhakrama Vamana is indicated as a Sharira Sodhana procedure, where the Kapha predominant Jwara, we have to go for that. So this is usually effective in case of chronic febrile fevers, where especially of non-GI origin pathologies. So the GI should be somewhat intact to go, because the patient has to undergo Snehapana, etc. So Snehapana and Swedana is a prerequisite in this mode of Vamana. So this is one case which was very interesting for me, and I treated this patient with a tropical eosinophilia. So we know previously tropical eosinophilia, they didn't knew why this happens. And now the relationship between filarias, etc., since last 20 years, it is established, right? So this, so in Kasaragod district where I was practicing before, there was an endemic area of filariasis there. So this patient, a male aged 31, who presented with a fever, dyspnea, and eosinophilia. And the patient was treated with a DEC in a modern facility, suspecting filariasis. And but still after that, the patient continued to have evening rise of temperature. And this respiratory symptom was there. So what we did is, we gave Dibana measures, and we gave Snehapana with Indukanda Krita for 4 days. And we gave Swedana on the 5th day. and Madana Yashti combination was used for Vamana. And after the procedure of Vamana, after the Samsarja Krama, 3 to 4 days after the Vamana, the fever went off and the dyspnea also improved. And the patient was put under some other Shamana medicines for a period of, I think, 2 months. The patient was under treatment and the patient became okay. So these are some areas where we can apply the Yadhakrama Vamana. So the prerequisite is that there should be some Agni in the Koshta, and the patient should have good appetite so that we can apply the Snehavana. So next is Virajana. So usually in case of other infective fevers, etc., we usually give a simple Koshta Virajana without any preparation. That is usually given. But this Virajana, what Ajay told, is along with the Snehapana and all. So it is to be administered in the Niramavastha of the Jwara. And it is very effective in endogenous fevers. So this is what we discussed, the exogenous causes of fever and endogenous causes. Exogenous infective fevers, in most of the cases, there is no relevance of this, what you call Yadhakrama Virajana. But in case of endogenous fevers, chronic pathologies which have on and off fevers in them, here this Virajana is very important, especially autoimmune and autoinflammatory pathologies. So this was a case of chikungunya where we applied simple Koshta Virajana. So this happened in 2008 when the chikungunya outbreak was there. So a 66-year-old female. So she developed a fever and arthralgia and was diagnosed as chikungunya at that time. And the fever was there for 4 days, following which she developed a nasal bleeding. And she was taken into a modern facility and they gave some drops, etc., to arrest this bleeding. And after they arrested the bleeding, the patient developed severe arterial rashes and burning sensation all over these rashes. So the patient again came to us. So what we did is we gave Avibhati Churna. So already it was 8th day of the illness. So we waited for some 2 days with some medicines. The patient was not responding. So we gave Avibhati Churna Virajana on that day. And within 2 days, all these skin eruptions, arterial rashes, etc. went off. So this is a simple Koshta Sodhana that we gave. And this is another case of typhoid. So it's a 20-year-old male. So the patient was a diagnosed case of typhoid. The blood culture, etc. was done. The patient was put under antibiotics for a period of 2 weeks. And the inflammatory markers, etc. became normal. But the patient developed weakness and a mild icterus also the patient developed. So what we did is we gave initial Pajana with Pajanavada Kashaya and Sudarsana. And since the Agni was somewhat okay, we gave Tikta Vrata Snehavana for 3 days in small dose. Not this Arohana Krama. We just give a small dose of 75 to 100 ml. And then the Virajana was given with the Tribur Churna. And within a few days, the fever and icterus relieved. So in these areas, we can apply the concept of Sodhanas, provided the patient has enough bala to undergo this. So this is another case, a case of rheumatoid arthritis with recurrent fever. So this patient again is a diagnosed case of rheumatoid arthritis. The patient didn't have any other causes that can explain the recurrent fever. And the patient had good appetite. The Koshta was okay, but the patient still gets. So this is the concept where the Dhadugata Jwara is important. Not in acute febrile response, but in other cases. So the constant ama in the Dhadu is the culprit here. So we gave Pajana with Panchagola Fanda and Amavadari was also given initially. Then Snehapana with Induganda and Virajana with Eranda Thaila was given. And after the Virajana, some surgery, etc., then the fever went off and the patient continued to take the rheumatoid arthritis treatment. Next is regarding Vasti. So usually it is not advisable in febrile episodes, and I have not done this in my practice, to be frank. So I think it is maybe some experts are there in this platform who can advise me on this, because I have not tried any Vasti in a patient with fever. So especially in infective causes, I have never tried that, but I have found that effective in case of fever that is associated with the chronic autoimmune disease like SLE, etc. So this is a case of SLE with fever where we tried the Guduchiyadi Vasti, which is told in Jwara Chikitsa, Charaga. So here what the patient had, the female patient aged 42, the patient gets recurrent fever, myalgia, and a relapsing and remitting vasculitis as well associated with SLE. So patient was very krisha, very krisha and unfit for Snehapan and Virajana. So we tried Vasti here and the patient gave excellent results. The fever went off. The vasculitis also came down, and later on the patient was put under other Shamana medicines. This is another case where Vaidarna Vasti gave result in case of a patient with rheumatoid arthritis. Here also The patient had Vishama Agni, so that Vata associated Agni was there. So the appetite was very irregular. So Vaidana Vasti was given, no internal medicines, but I usually what I do is whenever I give Vasti, no other internal medicines will be given. So Vaidana Vasti without any internal medicines was given, and the fever and pain got relieved. Even the ESR and CRP reduced within the 10 days of the procedure. Next is Nasya. I'm going to conclude within 5 minutes. I think the moderator has switched on the camera. So maybe it's a warning sign for me.
No, sir.
I will finish within 5 minutes. So Nasya, whenever the fever is associated with Urdhva Chaturveda features, it is beneficial. And I have read that it is used in Sapnya Prabodhana, but in my practice, I didn't get any patient, to be frank, in these 15 years who lost consciousness. Maybe in Kerala, the people are very educated. So they know in which condition they have to come to an Ayurvedic hospital and which condition they have to go to the modern hospital. Maybe outside Kerala, you will get a lot of patients. But I have not tried Sapnya Prabodhana in a fever patient. But I have tried other measures like Tulasi Swara Savabhidaga Nasya, etc. Whenever the patient has severe particle nasal congestions and all. And they have found to be very effective. And Jiraka Dwaya with Lishun and Hingu, Dhavana Nasya. Then Mukadukadi Guliga is usually practiced in Kerala. But in my practice, I have used very less Nasya. Rakta Moksha, also the same way. I think Siraveda is the common thing that is told in the textbook. Whenever there is severe Rakta involvement, especially in chronic fevers, especially that is of endogenous origins, I think it is beneficial. I have tried in one patient, that is not Siraveda. I have tried Jaloga in a patient with giant cell arthritis. But here the one problem is that the patient was already under steroids and the patient had severe pain, etc. So we applied 2 sittings of Jaloga in that patient. And the patient had a good improvement in terms of pain and all. But I'm not claiming that this is maybe because of that, I don't know, because the patient was already under steroids and NSAIDs. But I think in such scenarios, we can try Rakta Moksha as well. Then 2 important concepts that are very important in our practice is the concept of Leena Jwara and Punaravartaka Jwara. So these 2 things I have used extensively in my practice, and it was found very beneficial. So this is a case where an HSP was developed in a patient. So the patient had a fever and a diarrheal episode 3 weeks back. And after that, after 2 to 3 weeks of the illness, the patient developed purpuric rashes all over the lower limb. And the patient was diagnosed as HSP in a modern facility. So here what we diagnosed it, there are 2 options. One is we can diagnose it as Jwara Ubadrava. So Rakta Pitta is an Ubadrava of Jwara. Another thing is we can consider this as an ongoing process. So there is a Leenatva in the Dhatu, in the Rakta. So this is a Leena Jwara. So we went with the concept of Leena Jwara. Anyway, whatever name you call, the medicines will be similar, right? So we gave Tikta Pajana with Pajanamurtha and Gobi Chandana Adipuriya. So this is what I told you about the combinations. Why not Vettumaran with the Pajanamurtha? Because Vettumaran is something that is Ushna and Tikshna. Usually it is not advised in Pitta Jwaras. So here we wrote Gobi Chandana Adipuriya along with the Pajanamurtha and followed by Vasha Guduchadi and Chandragalarisa. And later on the patient was put for a Leena Jwara Chikitsa so that the Snehabana was given with the Tikta Grudha and Virajana with Trivrit Churna was given. And the patient completely resolved all these complaints. Again, the modern doctors, they may say HSP is a self-limiting illness, so it has gone on itself. Maybe, I don't know. But that's also another thing that you can claim. This is another interesting case. This is one of the relative of our students. One of our students' relative. So this is a male aged 47 or somewhere around 47 with a history of fever and cervical lymphadenopathy. And it was diagnosed something like infectious mononucleosis. And 10 days after the initial episode, the patient developed a fever again. And again, the patient continued to have this enlarged lymph nodes. So we diagnosed it as Punaravartaka Jwara, and we gave Punaravartaka Jwara Harapada. We usually use that in our college here. And after the administration of this Punaravartaka and Arogyavardhini Vadi, the fever subsided within a week. And later on, we treated the lymphadenopathy with the Indugandha Grudha, Kanjanara Ugru, and Anulomana, etc. The patient was treated and the patient became okay. So these things you have to keep in mind that Jwara, whenever happens in our body, there are 2 options. Either the patient will kill the Jwara or the Jwara will kill the patient, right? So that is why two options are there. And in the second option, where the patient kills the Jwara, again there are two options. The patient will be totally normal, or the Jwara will leave something with you as an asset. So that Vaigalyam va prayachati, it is told. So post-febrile. So we have seen a lot of patients, right? I have treated patients with TB meningitis induced encephalopathy and resultant paralysis. And the TB might have gone off, but the paralysis remains. I have treated a patient with viral encephalitis, a girl, viral encephalitis. And after the episode of viral encephalitis, the patient totally developed mental retardation. So such things can happen. That is why Vaigalyam is very important. So in all those scenarios, what you have to do is, you have to incorporate the Jwara Chikitsa there also, because all those things happen as a secondary to the Jwara. So you incorporate the Jwara Chikitsa. You start right from the Deepana, Pachana, Snehapana, etc. And you try to use Jwara yogas told in the Jwara Adhikara in all those things, because we have found it very beneficial. And regarding rasayanas, there are a lot of rasayanas that you can use. Again, in COVID-19, I have a lot of data with a lot of rasayanas that we give in the patients. Due to lack of time, I am not sharing all those things. You can go for single drug regimens like Pipali, Leshuna, etc. Or you can select rasayana yogas, or yogas that have rasayana properties like Indugandha, Amrita Prasakita, Javana Prasakita, a lot of things. I just mentioned here some of the names. Or even rasa drugs like Rasamanika, I use extensively, especially in case of auto-inflammatory fevers, etc. Rasamanika is very, beneficial. Malla Sindhura, there are a lot of rasa drugs that you can use for the rasayana purposes. So that is in short about the Jwara Chikitsa. I hope I was of some value for your time that I have taken. And I thank once again for all of your patient listening. So that's it from me. If something is there to discuss, we can.
Thank you so much, sir. First of all, from the bottom of my heart and on behalf of Ayurveda Map and KAP, I wholeheartedly thank you so much for giving us deep knowledge regarding Jwara. And I hope that who have listened to your class have mastered Jwara and will be practicing it in a better way. Thank you so much, sir. And also, before we go into the discussion, I would like to invite Dr. Muhammad Yasir. He is MD and factory in charge of Dr. P. Alikuti's Cortical Ayurveda Pharmacy, Cortical. Welcome, sir.
Good evening. First of all, that the session is a good session. Thanks, Dr. Mukesh. There is a good session given to us, a valuable knowledge sharing between us. And I need 5 minutes to introduce our product related with the Jwara, especially Vadajwaraharam Kashayam. Vadajwaraharam Kashayam is our patent medicine. Is a good result on chikungunya outbreak time. And above this Vadajwaraharam Kashaya, that Kashaya having around 12 drug is there. The 12 drug combination of that Kashaya is the Vadajwaraharam Kashaya. And that Kashaya given a good result in chikungunya outbreak time. And other regular medicines like Patya, that means some drug mentioned here, that Pajana Amrita or Amrita Kashaya, Drakshadi Kashaya, Patya Kustumbradi Kashaya, Vyakradi Kashaya, etc. Kashaya, all that preparations are now here. And any doctors or any practitioners having a need for a further or specific medicine for their practicing, that also we are preparing. Then we have a lot of license or a lot of formulation is there, for license formulation is there, but not yet prepared. That license, that production, that products also we have. And further we have discussing regarding that on last session or on last week, we have discussed that for practicing doctors and hospital, they have some assisting instrument is there needed. We have a good, reliable and quality Vasti syringe, disposable Vasti syringe is there. If anyone needed for that, you please make contact with the Ayurveda Map for KAP itself. Thank you all for thanks all for this good session and associated with us. Thanks.
Thank you, Doctor. We'll go into the discussion part. If you have any kind of doubts, you can put it in the chat box. We'll be discussing that. Mukesh sir, can we go forward with the discussion? We have few questions.
Yes, please.
Sir, the first question is, when to use Shadanga Paniya after 3 days of Lankana?
Shadanga Paniya can be used right from the first day, but only thing is that ask the patient not to drink too much. Take sip by sip in small quantities you can use, and make sure that in case of Pitta predominant Koshta and Pitta predominant Jwara and the patient who has oral ulcers, burning sensation, etc., Nishunti Shadangam should be used. So Shunti should be kept out and the other can be used.
You have already discussed about the Vamana. Sir, any Sadhyo Vamana medicines that can be used?
No, usually what I do is if the disease is of Ajirna in origin, I usually ask the patient to trickle the throat and vomit if possible. Suppose if I suspect that some indigested food is remaining in the. Otherwise, you can use Lavanodaka or Madana Yoga also you can use. HP Fanda can be used. So based on the dosha predominance, you can select that.
Sir, also, can you please share the case of TB meningitis?
We have treated a few cases of post-meningitic, what you call sequelae, we can call it. One case was a military man who came admitted in our college here. He was working in the Northeast and he developed a TB from there and TB meningitis, and he was treated there in the military hospital, and following which he developed a paralysis. And he was brought here and we did a Jwara Chikitsa itself. So, and at the last we gave Indugandha, Snehapana, etc. And the patient was able to walk with support. I'm not saying the patient became okay, but the patient was able to walk with the help of a walker. And the upper limb almost improved, I think. So we can give some results, but if it is very chronic, that means some 2 years back this happened, then we cannot manage it. We can just do conservative management. This patient came to us after some 2 to 3 months of the episode, so we could be able to do that. And there was another case of a transverse myelitis case, a female. Actually, she was brought on a stretcher. A viral fever was there, following which she developed a transverse myelitis. Again, we gave Jwara Chikitsa, nothing but Jwara Chikitsa, and she became okay and she walked out of the clinic. So there are areas. That is why Nidana assessment is very important whenever a patient comes. The patient-specific Nidana has to be assessed if you have to do the treatment.
Thank you, sir. Sir, how to treat post-COVID Daurbalya and Angamarta?
Again, in post-COVID, 3 types of individuals we get usually. One individual with the Kapha predominant features, like as you told, Anga Gaurava, then full-time sleep, laziness, etc. In such individuals, go for Kaphagara Chikitsa. So you give Indugandha Kashaya, etc. Then there are individuals who typically develop Vata Kapha predominant features like exertional dyspnea, cough, chest pain, very less amount of sputum, etc. In such individuals, we usually go for Balaji Ragadi Kashaya, Elakanadi Kashaya, then Magaradhoja Vadi, then Shringa Basma can be given. There are a lot of things that we can try. Bringaraja Sava is an excellent option in such cases. Then there are individuals who come typically with the Vata predominant features. So total Daurbalya, then fully emaciated body. In such cases, you give some Dibana, then you put the patient on Grida. We use here Indugandha, Amritaprasha Grida, etc. And we get very good results. So always assess the Lakshanas and you try to draw a yoga from any of these Adhigaras. So Rajakshma Adhigara, Jwara Adhigara, Kasa Shwasa Adhigara, and Vadavyadi Adhigara. Hridyam Yatsyad Aujasya Manasam Samprasadam, Charaka Sutra, 30th chapter, one sloka is there. So in COVID-19, what we have seen is there are 3 types of manifestations that we see. In some individuals, there are no lakshanas, nothing is needed. So we just ask them to follow normal diet. That's it. No medicines. Then there are individuals who get small features and small complications like that. But there are some individuals where totally there is a what you call Sannibada Jwara, and the Sannibada Jwara ends up in Oja Visramsa. And once this Ojas is affected, then afterwards you have to treat, you have to replenish that Ojas. In such individuals, these Aujasium medicines are very, very important in practice, especially post-COVID ICU. After ICU, there is what you call a cachexia and all those things can happen. Post-ICU care. Then there can be a post-viral, what you call fatigue syndrome can happen. So all those things happens when the Ojas gets involved. So use Aujasium, etc. medicines. Again, there is a question post-COVID hair fall. So all these things happens because of the impact of that fever on Rasadhatu and Ojas. So you give something that improves the Rasadhatu. Anything that improves the Rasadhatu will take care of the hair fall.
Sir, in case of lung fibrosis in post-COVID?
In young individuals, if you get lung fibrosis, that in early stages, we are able to treat. Basically, you treat in the line of Rajekshma and Kshayaja Kasa, and you get very good result. Initially after Agni Devana, you can use the yogas explained in Kshayaja Kasa and Rajekshma. But in individuals usually above age of 45 to 50, we have tried so many medicines. We tried X-ray pre and post, etc. Even though the patient has some clinical improvement, X-ray changes are very minimal.
Okay. Sir, in rheumatic fever conditions, what all medicines can be given?
No, again, that depends upon the patient. If patient has Pitta Pradhan features, you have to go for Vada Pittahara medicines. If the patient has Kapha Pradhan features, so you cannot say rheumatic fever. That's what my humble request to all the practicing doctors. Please don't learn in such a way rheumatic fever is equal to Rasna Sapta and Kashayam. That is not the way. You identify the Roga Avastha in the patient, because a rheumatic fever patient will come to you in several clinical scenarios. If a patient comes to you with a chorea movements, etc., you may have to give Akshayavaga chills at that point of time. And if the patient comes to you with a fever, usually people try to correlate rheumatic fever with Amavada. But I personally disagree, because the name itself has fever in that, right? So rheumatic fever should be treated in the line of Jwara Chikitsa, not Amavada Chikitsa. Maybe in the later stages, it can be considered as Amavada, I don't know. But in rheumatic fever, usually Jwara Chikitsa is the most important that we have to give. Assess the dosha predominance in the given patient, and as the pattern that I have observed in my practice, usually it is Kapha Vada predominant in the initial stages, and later on going into Vada Kapha or Vada predominant features. And in some individuals, there are Pitta features like Erythema nodosum and all those things. If it is there, then you go for Pajanamrita, like that in the what you call Shadangam, etc., etc. things. So look at the Lakshanas in the given patient and then you treat. And please don't identify a modern disease and correlate with an Ayurvedic.
Okay, sir. Sir, Dr. Ujjwala, she has asked that how to treat viral pharyngitis with mild fever and dry cough in COVID patient. She has given Sukhama Sukshma Triphala and Kamadutta internally and Yashti Gandusha, but not responded well.
Can I speak to the doctor, because in which day of the fever she has treated?
Yes. Ujjwala, you can unmute. Dr. Ujjwala, you can unmute and speak.
Hello. Sir, actually the fever was on first day.
Okay.
So that time I didn't give, but after 3 days I have, maybe 4 days I have started that Sukshma Triphala and Kamaduta, because it was very reddish color. That lesion was very bright red color.
Okay. So usually what happens is you can give go for some of the Pittahara Kashayas as well, I think. Maybe as I told, Pajanamrita can be given.
Drakshadi Kashaya?
Pardon, Drakshadi can be given in the later stage once the Agni is okay, because Drakshadi yoga is told as Fanda, right? And but we are using it as Kashaya. That is one of the most contradictory thing that we are doing now. But for digesting Drakshadi, the patient needs some Agni. So you try Pajanamrita Kashaya first. And the second thing, what you can do is you can give Haridra, mix Haridra with Grida and ask the patient to apply in the throat. That is one thing that you can try. And Patya Kustumburadi Kashaya can be given in such patients. Sudarsana Guliya can be tried. Chandrakala Rasa can be tried. Anyway, you told that it's already 4 days or 5 days over now. And if the patient has good appetite, after the 10th day, you can start the patient on Tikta Grida as well. So once you start Tikta Grida, if the patient has appetite, then all these oral rations will go off.
Hello, sir.
Yes.
Actually, what we say now, when the COVID virus will attack, where there is a Vaigunya, and this patient is having recurrent throat infection, means every time if he eat a onion or if he drinks any cold water, he will get that throat infection always. So how to treat this?
It is, I think on a long term, if you want a long term solution, I think the patient has to go for a Yadakrama Sodhana. So you do Snehapana and do Vamana, not now, I mean later stages. You do Vamana, and then also you give a course of Virajana and put the patient on something like a Guduji Rasayana or a Eshti Madhu Rasayana. So you can go for giving Guduji Kwada on a Rasayana protocol, or an ST what you call tablets are available now. You can put the patient on ST Rasayana as well. And for the time being, what you can do, you can ask the patient to use Haridra Ganda also on a long-term basis.
Okay. Sir, for Snehapana and Snehapana, which Gruta should be used, sir? This patient?
That depends upon the patient's what you call Satmya, then Prakriti, etc. But I will give you options. You can select from that. You can use Tiktaka or Mahatikta Grida, or even you can use Vidaryadi also. But if Kapha features are there, it's better to avoid Vidaryadi. If Pitta Kapha predominant is there, it is better to go for Tikta Grida. Or even you can use Kalyana Grida also, because that is also beneficial in such a case. And if there are no much Kapha features, only Pitta and Vada is there, then Vidaryadi Grida will be the better choice.
Okay.
Okay, sir. Thank you so much.
Thank you, sir. Next question. Sir, Dr. Karthika is asking that why did you skip the first 2 meals and gave a light food or medicine in the evening in the Lankana?
There are 2 things in that. One is I tried different options in my patients, and even some of the patients they are not ready to skip breakfast. So what I will tell, I will tell them, you take breakfast, but if you are able, you skip the midday meal, or you skip the midday and evening meal. So in such patients, I ask them to take food in the morning. Otherwise, I ask them to skip morning and evening. So there are 2 concepts. There is one sloga. Juridam Jwaramuktam va dinande bhojet leghu. That is told. So even in the stage of Jwara or in Jwara Mukta, even if you are doing Langana, it is better in the Dinanda when the Kapha is less and Vada is more. It is better to give some food, because everything is dependent upon Rasa and Ojas, and you need some Rasa and Ojas, isn't it? This we can speak in the mode of modern as well, because we need glucose, right? Our brain, etc., solely relies on glucose. So once the febrile response starts, the body switches into ketogenic mechanisms. Brain especially can rely on all these ketogenic things only for a very small amount of time. It needs some glucose, right? So it's unethical or unideal to completely put the patient on Lenkana. So whenever one day, if you're planning, okay, it's okay. If there is Ajirna, one full day you can put the patient. At least on second day you have to give the patient something. But if you're planning for a prolonged days of Lenkana, then this modified plan, that is 2 meal, avoid 2 meal and 1 plan, will be beneficial. So it has a science behind it, and even in my practice, based on the patient's convenience, you can modulate it accordingly. See, there are a lot of studies going on now in rheumatoid arthritis and fasting, and now with all these new data that is coming from the study of gut microbiota. So these things are getting what you call connected now. The dots are getting connected more and more nowadays.
Okay. Sir, how can we treat tonsillitis?
That is a very what you call thing, because in some kids tonsillitis is so resistant that we'll we'll surrender all our armory and we will say, okay, you go and do surgery, isn't it? So it's a very big question, and I'm not that much expert in treating kids, but I think in kids it is very difficult. Adults, I think we can go through. If the patient has Jwara, then go with Jwara Chikitsa. Otherwise, you can go for all those what you call Mukharoga Chikitsa, etc. and all. But basically, what I found is Pitta Kaphagara Chikitsa is the basis of tonsillitis treatment, unless there is some fibrotic change that is going on. But basically, Pitta Kaphagara Chikitsa is ideal for a patient with the tonsillitis. One important thing is you ask the patient when the patient takes bath. Usually in such patients, they take bath in the evening. So first you ask the patients to stop taking bath in the evening. Make them to take bath in the morning. And then you start giving medicines. Usually the patient will start responding, and give all the things that are present in your artillery, which are Pitta Kapha. Trifala Gugulu, Gandhaga Rasayana, a lot of things you can. Patyashadangam Kashayam, Varanadi Kwadam. A lot of things you can give. You can give Talam with Rasnadi. A lot of things you can do.
Sir, as a complication of COVID-19, exertion is seen in some patients even after 2 months. So what can we advise?
That's what I told. The same thing that I want to tell you. There are two things. One is the pranava srodhas is affected. The rasa hridaya ojas is affected. See, all are interlinked. So you have to address that.
Sir, a patient developed costochondritis after COVID infection. So can you please suggest some medicines?
Maybe I don't know, because I have not seen such a patient with costochondritis after COVID. Costochondritis we are getting in routine practice, but after COVID I don't know. Maybe we can give some Lakshana medicines. Deshamula is a very effective drug in such a scenario. Deshamulam, Kashayam, Goshradi, Ugulu, etc. will give very good result. And is she from Kerala? You will get Karthavatu. You can try Karthavatu application.
Okay. Sir, another question. A patient who was COVID positive but no fever, but he has dry cough, especially which aggravates at night, and no GI issues. Agni is normal. Now she is having complaint of heart pain and dry cough. So any specific medicine that we have to give?
No, if the appetite is okay, you can start her on Vidaryadi Girda. Vidaryadi Rayam Hrdyo Brahmano Vata Pittakash Osha Gulma Angamarda Udashwasa. So a combination of Bringaraja Sava and Vidaryadi Girda can be started in such patients if the appetite is okay. If the appetite is not okay, let them first correct the appetite and then put the patient on this.
Okay. Sir, what is the other type of Vamana, like different from Sadhyo Vamana? Can you explain?
No, that I already told in the class, right? Where you have to go for the Snehavana and then Vamana. So that is the proper Vamana as a Sodhana procedure. What Vamana, Acharya told in the initial part of the Jwara is Sadhyo Vamana, where you don't go for Snehavana at all. You give the Vamana Ushati and you take, because already the doshas are Urdhamugi Buddha. So they are trying to get out. Just you have to initiate that. That's it.
Sir, how to treat recurrent Jwara in kids with no other clinical symptoms like PUO?
No, usually PUO will have some other conditions. You have to investigate the kid thoroughly, because a fever beyond 21 days without any positive investigations are considered as PUO. But some other things will be there. So you have to investigate and then you treat. In the meantime, you can try all our Jwara Chikitsa, etc. But in kids, the problem is that we cannot go for all these Snehavana, Virajana, etc. So try most of the Shamana Aushadas in the patient. But investigation, most of the kids will have, either the patient will have some sort of parasitic infestation or primary complex, etc. Some hidden focus will be there that has to be found out. So palpate the lymph nodes, you do all the investigations. Then still, if the fever is there, then you have to suspect factitious fever as well. And if still it is there, you have to probe the patient for some genetic metabolic errors or something.
Okay.
Because in kids, simply there will not be any fever.
Sir, can you please advise a treatment for productive cough and dry cough?
Productive cough is usually kapha pradhana, so you give kaphahara medicines. If the patient's kosta is not having any pitta, you can go for all these Yoshadi Vadaga, Deshamula Kadatre Kashaya. So a lot of Vada kaphahara drugs. If the patient's kosta has pitta and the patient has productive cough, then there is a problem, because most of the kaphahara medicines may insult the pitta. So you go for Haridra Ganda, Karpuradi Churna, so which Talisadi, etc. will not increase that much. So like that you can go. In case of dry cough, you can also try Kandakari Grita, Vidari Adigrita, etc. that I have told. In case of productive cough, you can try Pippali Rasayana. Especially we have tried that here in Shantigiri, they prepare a Pippali Rasayana, right? So that Pippali Rasayana, the Simula Rasayana, Tambula Leha is there. So there are a lot of yogas in that. In case of Kashayas, you can try Bharangyadi, etc. in case of productive cough. Bharangyadi is a beautiful yoga. We are using extensively now in COVID-19 because it is especially told in Jwara with the respiratory features.
Sir, one last question. Sir, a patient who is having Rajekshma is having Jwara, but he is taking allopathic drugs. So what can we give?
Now the question is, what the Rajekshma he implied here is tuberculosis or not? Because every tuberculosis is not Rajekshma and every Rajekshma is not tuberculosis. So the question is whether it is tuberculosis. If it is a tuberculosis and if there is fever, what we can do is most of the times this AKT will have it will induce some hepatic injury as well. So try to include some hepatoprotective drugs also. You can try some Shamani Vadi in such a patient. Guruji is equally hepatoprotective as well as it is. So better to give Pitta Vadahara, Vada Jwarahara medicines. So as I told earlier, Pajanamrutam etc. can be given. Gopi Chandanadi, Sudarsanam Gudiga, Arogya Vardhini can be given. A lot of such medicines can be given. So if in order to specifically prescribe, I may have to see the patient. That's why I can give options.
Okay, sir. Thank you so much, sir. So that's the end of the questions in the chat box.
Thank you.
So
Thank you.
I request and I invite Dr. Jasul. Over to you, sir.
Thank you, sir. Thank you for your wonderful session. You just cover all the treatment principles of Jwara in a practical way. And now I invite Dr. P. Rahmatullah, sir, the Chief Physician, Kottakkal Ayurveda Modern Hospital, Ayurveda Modern and Ayurveda Hospital. Okay, sir. Hello. No, sir. Can you increase your volume? Hello. Sir, little bit loud. You can. Okay. Okay now? Yes, you can.
Good evening, everybody. Thanks, Dr. Mukesh, for your good presentation. I believe all of them enjoyed this Jwara this evening. Tough subject in the time of study. Most of the classes, I believe, previous like 3 months to finish the chapter of Veda. So this is a subject. After studying the Veda, we can treat all the diseases commonly telling like that. Thanks, Dr. for your Jwara is simply and lovely presentation for the participants. I believe it's a very good session to report. Start with the this is an important thing about when you want to refer the patient. This
Hello. Yes, in between there is a break. Okay. Yes, you can continue, sir. You can continue.
We know our limitation. So Jwara, we can start the Jwara very well. The class is very I believe complete all the part of the fever. We already mentions, and I touched all the part of the fever, and he give his clinical experience, share the it is very is, helpful to the participant and doctors. I believe this is a very good session, and thanks to Dr. Mukesh again and for his 1.5 hour presentation. Thanks to Dr. Jasul and his supporters and all the participants, and Dr. Yasin also. Okay, thanks. Good night.
Thank you, sir. Thank you, Ram.
Thank you, sir. Thank you, Dr. Jasul. I hope we'll wind up the session over here. So once again, I would like to thank Dr. Mukesh sir for this wonderful session.